Hello, everyone. Good evening. This is Mrs. P. Nagaharita, Associate Professor from the Department of Pharmaceutics. And today we are going to discuss in this webinar about the powders. So why we need to study about the powders here? It is generally about the pharmaceutical powders, and coming to the contents that we are going to cover in this webinar are, we are going to see about the introduction about the powders, then we are going to see the classification, a very important and a very vast classification. However, I'll make it simple for you. And then the third one is the general method of preparation. So coming to the introduction of today's topic. So these powders are nothing but the preparations which consists of the solid loose particles. Okay, so it consists of a solid loose drug particles of varying degrees of fineness. Here the fineness is nothing but you can consider the particle size, like whether they are the coarse particles or fine particles. How do you differentiate the coarse particles and fine particles is depending upon the sieve number through which the particles would be just passing through. Okay, so by varying degrees of fineness, which contain one or more active ingredients with or without excipients. You know the difference between what is a active ingredient and what is an excipient. So the drug which shows the therapeutic action, it is an active pharmaceutical ingredient, and the other materials or the ingredients which we use for supporting the active pharmaceutical ingredient in various ways, we call them as a excipients. And these powders, they can be used either internally or externally. And for internal use or parenteral use, either they can be used in the form of a solution or suspension just before the use. We call them as a reconstituted powders. Reconstituted powders are nothing but when you buy them from the pharmacy, they will be in the form of a powder. However, when you want to administer them, like when you want to take them either orally or parenterally, you have to mix them. If it is orally, you have to mix them with the distilled water, or else if you want to administer that parenterally, then you have to mix it with water for injection. Okay, so either it can be in the form of a solution or suspension, and it can be taken either orally or parenterally. So coming to the advantages and disadvantages of the powder, first let us see about the advantages. So it is more stable than liquid forms. Stability, when we discuss about the stability, obviously they are stable over the liquid forms because the liquid forms contains the vehicle, aqueous vehicle, either the water or an organic vehicle will be present. Most of the times, the vehicle would be the aqueous vehicle. Aqueous vehicle is nothing but which is a good source for the contamination. So there is a chance of the contamination. That is why we say powders are more stable than the liquid dosage forms. And incompatibility problems are very less because we will be mixing them in a physical form. We are not going to mix them with the help of certain vehicles or something. So as we mix them only in the physical form, we are not converting its chemical nature or the physical nature of the drug. That is why the incompatibility problems would be less. Though you use active pharmaceutical ingredient along with the excipients, the incompatibility problem will be very less. And it is easy to dispense the crude vegetable drugs because the crude vegetable drugs, whichever you are going to extract, when they have to be converted into the formulation, they have to be mixed with various ingredients. So during the mixing of those drugs with the ingredients, there may be a problem of incompatibility. But when you are mixing them as it is, how it is received, when you are dispensing, then there is a no problem. So it is easy to dispense the crude vegetable drugs. And it is easy to administer in children and geriatrics than tablets or the capsules. Okay. So if you find a very small child or a very old person, geriatrics are nothing but old people, elderly people. Okay. So when you have a child, a pediatric patient and a geriatric patient at your home, you can just get experience with them. Instead of giving them a tablet, if you just take the powder and if you just mix it with any vehicle like either honey or milk or even water, they can easily swallow. So that is why we say they are easy to administer when compared with that of the tablets or the capsules. And they are easy to carry, transport than liquid dosage form. So when you consider a liquid dosage form, it will be in a container. Okay, so it will be a bulk dosage form, which will be in a container, and it is tough to carry, and most of the containers would be in a glass container. So it is difficult to carry them. However, the powders, you just wrap them in a paper, you just keep it in your wallet, you can carry the powders. So they are easy to carry. And faster dissolution because of larger surface area, obviously. So you know that the surface area, the particle size is inversely proportional to the surface area, and surface area is directly proportional to the absorption and dissolution. So lesser the particle size, more will be the surface area. For example, let me give you an example. Let us take a chalk. Okay, if you take a chalk and place it over the dissolution medium, only the area which is coming in contact with the dissolution medium, it is having the contact with the, that is called as the effective surface area. However, you just make the powder out of the chalk, and you just spread it in the dissolution media. It will be spread all over the dissolution media, right? So that means lesser the particle size, more will be the surface area. And now you must be understood, the powders will have the more surface area, so they have the better dissolution. So all these comes under the advantages. So wherever we have the advantages, followed by that, we do have the disadvantages also. So let us see what are all the disadvantages that we have with the powders. The drugs that deteriorate on exposure to the atmospheric conditions, and volatile drugs are not suitable. Obviously, volatile drugs are nothing but the drugs which will evaporate on exposure to the atmospheric conditions. So such drugs, they cannot be dispensed in the form of a powder, because such drugs, they require some shell like things. So they can be prepared either in the form of a soft gelatin capsules or the tablets, or and then they can be dispensed. So they cannot be dispensed in the form of the powders. And they are not suitable for bitter or nauseous drugs. Nauseous drugs which cause the feeling of the nausea. Okay, so why they are not suitable for the bitter or nauseous drugs? Because definitely when you administer the powder in the mouth, it will be definitely spread over the tongue, and the taste buds would come in contact with the powder. So the bitter drugs and the nauseous drugs cannot be administered as such. However, if it is a tablet or a capsule, you just put it inside the throat and you'll just have a gulp of water. It will be easy to swallow. It is not the case with the powder. So that can be considered as a disadvantage. Not suitable for hygroscopic and deliquescent drugs. You just remember the words here, because we are going to discuss in detail about this hygroscopic, not hydro. Please watch the spelling. Hygroscopic and deliquescent drugs. So hygroscopic drugs are those drugs which have the ability of absorbing the moisture, and deliquescent drugs are those which absorb the moisture and turn into the liquid. Okay, we'll discuss in detail in the coming slides. So for such drugs, preparation in the form of the powders is not suitable. And it is not suitable for the drugs that get inactivated in the gastric environment or gets gastric irritation, or also not suitable, because when you're taking it through the oral administration, it is directly going into the gastric environment. So all the drugs which causes irritation to the gastric environment, they cannot be supplemented as, or they cannot be administered in the form of the powders. And then preparation and dispensing is difficult. So here, difficult in the sense, there will be a lot of steps in the preparation as well as dispensing, because depending upon the variety of the powders, the dispensing would be different. Okay, we'll see in the next coming slides. So depending upon those things, there will be the different kinds of the powders. The dispensing would be difficult from one type to the another type. For example, eutectic mixtures, okay, efflorescent powders, like that. We have different kinds of powders where the dispensing would be different, and sometimes it would be difficult even. So these comes under the advantages and disadvantages of the powders. Now let's go to the classification of the powders. So depending on their physical form and intended use, the powders are classified. So Physical form in the sense like in which type or how many ingredients are being added to your powder formulation, and the way which the powders are being used. By considering these two conditions, the powders are classified as these types. So powders for internal use. So that means internally we are taking the powders. Then powders for liquid for internal use. That means before administration, they are converted into the liquid form and then they are being taken. Then parenteral powders. So parenteral powders are nothing but before administration, again, they are converted into either solution or suspension form and then they are administered. But however, here it is not orally, it is parenteral. Granulated powders. That means the powders have been converted into the granules. Powders enclosed in capsules and catchets, special type of the powders these are, and then compressed powders. And within these, again, we have various types. We'll see one after the other. So first, let us see about the powders for internal use. So these powders generally consist the drug in the form of a powder intended to be swallowed directly or in or with water or another suitable liquid. So powders, they will not be swallowed as such. You cannot swallow the powder as such. Have you ever observed? Suppose if anyone are fond of eating the rice flour or atta, generally, being a kids, you might have done. Okay, just you grab some amount of the powder and put it in the mouth. Are you able to swallow it? Definitely not. You have to you have to follow that with a gulp of water. So it generally, this internal use powders, they generally consist of an active ingredient which has to be taken along with the help of the water or any other liquid. And they are packed in single dose containers like paper packet or vials, like glass vials also. They will be packed, or even in a paper packets also they will be packed. And multi-dose containers provided with measuring devices. So not only the single dose containers, it also consists of the multi-dose containers. However, you'll be having a measuring device to measure how much amount of the powder that has to be taken. So powders for internal use, these are further divided into simple powders and compound powders. Compound powders are further divided as bulk powders and divided powders. So here the classification is dependent upon number of ingredients that your powders containing. Okay, the number of ingredients that your powder containing, these were divided into simple and compound powders, and compound powders are further into the bulk and the divided. So first, let us see about the simple powders. So simple powders, as I said, depending upon the number of ingredients, it consists of only one ingredient, that is only API it consists of. And it is either amorphous or crystalline in nature, and it is usually reduced to fine particles before dispensing. Because sometimes the crystalline powders, when they are having a larger crystal sizes, they have to be pulverized. Pulverized in the sense they have to be reduced in their particle size, and then they have to be taken, or else it will be difficult to swallow. So that is why we say usually they are reduced to the fine particles before dispensing. And then compound powders, they contain two or more than two ingredients. Simple powders, they have only one ingredient. In contrary to that, if any powder is containing more than two ingredients, then we call it as a compound powder. And different ingredients are mixed together and they are dispensed either in the form of a bulk or wrapped separately into the individual doses. That is what we have seen in the earlier slide about the classification. The powders for internal use into simple powders and compound powders are further divided into bulk powders and divided powders. So divided powders are nothing but the powders which have packed in the individual doses, right? And then bulk powders. So these are usually dispensed in bulk when the dose of the API is not so critical. That means you are not so much concerned about the dose of the API, even if it is more or less, to chalega, right? So like that, if in such cases, we use the bulk powders, and generally these are the antacids. Examples include compound magnesium trisilicate oral powder, and it consists of the following ingredients. It consists of magnesium trisilicates of 250 grams, chalk in powder 250 grams, sodium bicarbonate 250 grams, and heavy magnesium carbonate 250 grams. So when you see this is a combination of all these ingredients together, it makes 1 kg of the powder, and it is generally used as an antacid. And then coming to the divided powders, each dose is packed separately and dispensed. Just like how you have the tablets, like each tablet. Suppose if anybody is having a fever, what do? They just open the strip and they just take one tablet and take it. They don't divide the doses, isn't it? So already the dose has been calculated and it has been formulated as a tablet. In the same way, in the divided powders, the powder would be taken. It would be divided into various single individual doses and they would be packed separately in individual packets. This is for the convenience of the patient. Okay. And it consists of accurate dosage than the bulk powders. Obviously, here we doesn't have much condition for that of the API quantity, but however, here we have the exact dosage of the exact dose of the API. Example, aspirin 350 mg, caffeine 20 mg, and make a powder of 6-pack doses. So by combining these two, you are going to make the packets of 6-pack doses. That means 6 doses will be there. Each dose would be packed in each packet. So whenever there is any rheumatic arthritis or any analgesic activity, if it has to show, then aspirin, 1 packet of aspirin would be taken. And label, yeah, 1 pack to be taken when the pain is severe. So it is here, it is given analgesic. So then coming to the powders for liquid for internal use, as I said, before administering into the body, they will be converted into the liquid for the ease of administration, either solutions or suspensions. So antibiotics, these are unstable in the presence of water, so cannot be presented in liquid form. Even if you would have observed any dosages, especially the pediatric doses, when you go for the pediatrician, they would suggest you an antibiotic, but the antibiotic will be present in a bottle. However, it is present only in the powder form. And they will be giving you a liquid separately in a vial. Okay, the distilled water would be given separately and there will be a mark over the bottle. That means it shows that you have to add the water till that particular mark. Okay. So once when you add the water till that particular mark, you have to shake it well and then you have to administer it to the patient. And once after completion, then immediately you have to store that in the fridge, and that antibiotic solution, it has to be finished within 4 to 5 days. That's all. After that, even if you keep it in the refrigerator, it is going to change the color because it have the stability problems. That is why we don't prepare them in the form of a liquid form. We just prepare them in the form of a powder. Before use, you are just going to reconstitute them with the water. So hence, these are often formulated as powders and prescribed to mix with a prescribed amount of water before use and should be used immediately after reconstitution. Contains sweetening, flavoring, dispersing, and suspending agents. So all these are the excipients which consist along with that of the API. Generally packed in bottles that are large enough to hold the water for reconstitution. Just as I said, there will be a mark. So in a bottle, if the last quarter of the bottle is being filled with the powder, the other 3/4 are left for the filling with the water, right? And then along with general label, it should include the label for reconstitution and period within which the reconstituted solution or suspension should be used. So you are not only including the label as it has to be reconstituted, but also you should include the label by what time you have to finish using that particular solution, right? That is the important label that you have to give. And then powders for external use. And here under the powders for external use, they should be very fine state. It should be in a very fine state, which are meant for the topical application to the skin or into the body cavities even. You must have generally seen all these external powders like we'll be using betadine powder for the external abrasions. You'll be using candid powders for certain topical infections like that. Okay. So further classified as dusting powders and surgical powders. So these are the examples of the dusting powders which we have. Surgical powders are those powders generally which consist of an antibiotic in them, like the surgeries have been happened, they will be suggesting after the stitches have been made, the doctor would suggest to pour or to apply this powder over the stitches for the quick healing of the stitches. Okay. Then dusting powders, these are very fine, free flowing powders meant for application on unbroken skin. Very important that you remember, that is, the dusting powders are only meant for the unbroken skin. If you apply it for the broken skin, what happens? It enters into that particular broken skin which has been present on the body, and it may lead to the infection because you may not clean the wound properly, right? These are used as protectives, antiseptics, absorbents, and astringents. Here, whatever the dusting powder we are seeing, it is used as an absorbent. Generally, you'll be using during the summers, or your favorite prickly heat powders will be having. All those comes under the dusting powders. And the preparation includes the micronizing the active ingredient. Here, the particle size is very important because it should not show some rough abrasion on the skin. When you are applying it on the skin, you should not feel rough. Okay, so that is why it should be very smooth, and the particle size should be very micron in size. And then mix active ingredients like starch, kaolin, zinc oxide, and talc, and should be undergone with preheat sterilization to avoid the contamination. And the packaging is sifted bottle. Sifted is nothing but when you turn it clockwise, close, anti-clockwise, open. That is called as a sifted top or pressurized containers. Like when you press, then only the contents will come out of the container, right? So this is about the dusting powders. Then coming to the surgical powders, it consists of the sterile powders which are intended to be used on large open wounds or on severely damaged skin. You may ask me, madam, why the dusting powders are not used for the broken skin? Why only the surgical powders? Because during the preparation of the surgical powders, all the conditions which are required for maintaining the sterility of the powder will be taken care. However, that much sterility will not be taken care during the preparation of the dusting powders. That is the difference, right? So here, like however you are going to prepare the parenteral preparations, like following all the aseptic conditions, the same conditions would be followed even for the preparation of these surgical powders also. So that is why these surgical powders are eligible to be used on the damaged skin or the broken skin. And yeah, that is what. So they differ from dusting powder in their sterility. And certain compounds like antibiotics, they can be used as a surgical powders, which are unstable as a suspension or a solution. So such type of compounds, they can be produced as a powders, and they are reconstituted into liquid before administration using the sterile liquid. So those are the conditions for the surgical powders. Then coming to the granulated powders. So here the granulated powders are nothing but which consists of the solid granules of the powder particles, because like certain powders, they cannot be handled properly because of their fineness or because of their amorphous nature. So for that reason, we'll be converting them into the granules, and they are generally intended for the oral administration, and they are swallowed directly or dispensed in water or any other liquid before the administration. And they contain one or more active pharmaceutical ingredient, either with or without excipient. So how the granules will be formed? Again, here there will be two different methods for the preparation of the granules: dry granulation method and wet granulation method. Wet granulation method is nothing but you'll be using certain liquid component in order to mix the powders and then convert them into the granules, right? And then they are suitable for medicaments which have unpleasant taste or which have larger dose or unstable in the solution form. So the drugs which have the larger doses. So larger doses like 1 gram, 2 grams, they cannot be taken in the form of a powder because it will be difficult for them to swallow. Even it will be difficult to mix it with the water or other solution as well. So that is why they will be converted into the granules. So if it is a 1 gram of a powder, you can just take 100 mg of a granules. So that much of variation will be there from the powders and the granules. So in the granules, again, we have the effervescent granules. These you must be having very much you must be known very like in a regular day-to-day life about the effervescent granules. So these are the uncoated granules generally containing acid substances like citric acid, tartaric acid, along with either carbonates or bicarbonates which react rapidly in the presence of water. Your favorite, Eno. Okay, so when you just take Eno and put it in the water, it just splash the gas. That gas is nothing but the carbon dioxide. Okay, so here, because of the presence of citric acid and the tartaric acid and either bicarbonate or a carbonate, it is going to react and it is going to release the carbon dioxide gas. So example is effervescent sodium phosphate granules is the example for the effervescent granules. And then the next important one is the powders enclosed in catchets. What are these catchets actually? The catchets are nothing but they are rice flour packets. Okay, the packets which are, see, you would have observed some packets in the newly bought bags, okay, handbags or college bags, and even in the shoes or chappals, you will be finding some packets, is it not? So those packets are nothing but which consists of a silica gel. And that silica gel, it is responsible. Why we are using those things? Because it is used to absorb the moisture from the atmosphere so that your bags and shoes will be safe while they are displayed in the showroom. However, when you get it to the house, you'll be just storing them very properly in the shoe rack or in the cupboards if it is your bag. Okay. But during the storage in the showroom, they have to be protected from the moisture. So they have to, they are using that silica gel so that it absorbs the moisture. What is the relation between the catchets and the silica gel? The packets, the catchets look like that shape. Okay, I'll just show you that. So these are the solid unit dosage forms and they are molded from the rice paper, which is made by pouring a mixture of rice flour and water between the hot cylinders, hot revolving cylinders. So let me show you how they look like. So for example, these two are the cylinders that are present and they will be rolling. So these are the rolling cylinders and they are the hot cylinders. So you will be taking the rice flour solution and you will be pouring on this particular rolling cylinders. So when you have poured this rice flour on the rolling cylinder, it forms a thin layer. It forms a thin layer over the rollers. And as it is hot, it will be dried immediately and it will come out as a wafer. Okay, it will just come out as a wafer. And water evaporates and a sheet of wafer is formed and it is used to enclose the contents, nauseous or disagreeable powders, and are available in different sizes which can hold from 0.5 to even 1.5 grams. And these are also called as a wafer capsules. They are hard to swallow. However, just like how I said, you cannot take the powders as such and you cannot gulp, you have to use some water. So here the catchets are also difficult to swallow. So what we do is the catchets before administering, they have to dip in water and then so becomes easy. The swallowing will becomes easy by dipping in water and swallowing with a just gulp of water or a draught of water, and then gets disintegrated and then it releases the drugs. So here we have two types of the catchets, wet seal catchets and dry seal catchets. What are they? We'll just see about that. The wet seal catchets, it is made up of two similar convex halves having flat edges. Say these, you think that this is one half and this is another half. So they will be having the flat edges. These are the flat edges that are present here. So the drug is placed in one half and the edges of other half is moistened with water and placed exactly over the other half. So here in this half, I have placed the drug and the another half I'm enclosing and I'm just putting the water and then I'm enclosing it between. So between these two halves, your drug is present. Whenever you want to take the drug, dip this complete thing and then you can swallow. So flat edges of both the halves are firmly pressed to seal it perfectly. And the dry seal catchets here, how they will be like, the bottom part will be a little smaller than the upper part. Say this is the bottom part, my fist is the bottom part and the upper part will be little larger. So when you just press it like this, the bottom part will go into the upper part, top part, so that it will be sealed, just like your gelatin capsule. Okay, so it consists of two halves. The diameter of upper half is slightly larger than the lower one. So the drug is filled in lower half and upper half is fixed over it. And then sealing with the help of the sealing machine, it is sealed. Example includes sodium amino salicylate and sodium amino salicylate with isoniazid. So here you can see perfectly. So these are the two convex shapes that are present, and here this is a flat shape that is present. Okay. So here is a flat shape that is present, and here this is the lower part and this is the upper part, just like a hat. Okay, how the hat will be the hollow part and the flat surface, just like that it looks. So in the bottom part you are going to fill the drug, and the upper part, this flat edges are just moistened with the water, and then it fixed over the lower part. So here this one is the lower part in which the drug is filled, and the upper part, the diameter, which is a bit larger than that of the lower part, and then it is fixed. The upper part is fixed over the lower part. Okay. This is about the wet seal catchets and the dry seal catchets. Both the type of catchets. Why here the name wet seal catchets and dry seal catchets? Because for the wet seal catchets, you are applying certain moisture during the fixing. However, in the dry seal catchets, you are just placing the upper shell over the lower shell without applying any moisture. However, both the catchets have to be dipped in the water, and then only it has to be swallowed. Okay. So wet seal and dry seal is only because of the moisture which is involved during the packaging of your catchets, right? And then tablet triturates, which are also called as a molded tablets. So the powders are molded into the tablets here. They are the flat circular disc and usually contain potent substance which is mixed with lactose, dextrose, or some other diluent. And apparatus here, it is made up of either stainless steel or the plastic. And it consists of upper perforated plate, which is having exactly the same number of holes and the number of pegs in the lower plate. Don't worry, I'll show you the diagram. And the lower plate consists of two pegs that ensure correct fitting of the plates, and molds are available in various sizes which can accommodate from 30 mg of the drug till 250 mg of the drug. So here is the apparatus which we are discussing about. Okay, so this is the apparatus, the upper perforated plate, which is having exactly the same number of holes as the number of pegs. So this is the upper plate. Okay, and this is the lower plate, and these two are the pegs which are used to fix both the plates properly. So these two pegs will go into these holes, and then it will be fixing firmly. So in these holes, in the upper perforated holes, you are going to fill your drug content, and then in order to remove them out, you are using the lower plate, so that they come out as a molded tablets. These were used in the earlier days. However, now we are not using any tablet triturates or the molded tablets. Then coming to the hygroscopic and deliquescent powders. The powders that absorb moisture from atmosphere, they are called as the hygroscopic powders. After absorption, if they convert into the liquid, then they are called as a deliquescent. You would have seen in your practical laboratories about sodium hydroxide. Okay, so when you take the sodium hydroxide, your teachers, your lecturers would ask you to come on, fit the cap properly, put the cap properly, because it is hygroscopic as well as deliquescent. Once it is absorbing the moisture from the atmosphere, it goes into the liquid. Okay, it will be converted into the liquid. It is a deliquescent in nature. Ammonium chloride, iron, ammonium citrate, all comes under this category. And they should be supplied in granular form in order to expose less surface area to the atmosphere, and should not be finely powdered, because lesser the particle size, more will be the surface area. That is why you have to dispense them in the form of a granule rather than in the form of a powder, and should be double wrapped. Okay, why the double wrap? And in fact, if you use aluminum foils also, it would be more beneficial so that it cannot absorb the moisture from the atmosphere. So should pack in aluminum foils to give more protection. So this is one of the example of hygroscopic and deliquescent. If you observe, it is slowly converting because it is not as a free flowing powder, because it is absorbing moisture from the atmosphere, and slowly it will be converted into the deliquescent. And one thing you have to remember, that all hygroscopic powders need not be deliquescent. Okay. However, all the deliquescent powders will be hygroscopic in nature, right? You understand the difference between two. Efflorescent powders. Some crystalline substances, they liberate water of crystallization wholly or partly on exposure to humid atmosphere or during trituration and become water, wet or liquefied. Example like caffeine, citric acid, ferrous sulfate. That means here, these efflorescent powders, they just release the water out of them when they are exposed. However, the hygroscopic substances, they are absorbing the moisture from the atmosphere. But here, the efflorescent powders, they are crystalline in nature. And if you would have studied your physical pharmacy, now those belonging to third year or second year, if you are seeing this particular webinar, if you are attending, you would have gone through the physical pharmacy. And if you, only the first years are observing or attending this webinar, let me tell you, when the crystals are formed, there will be certain spaces in the crystals which will be occupied by water or any other organic solvents. If those spaces is occupied by the water, they are called as the hydrates. And if it is occupied by the solvent, they are called as the solvates. Okay. So such type of the crystalline substances, when they are exposed to the atmospheric moisture, they will be releasing that water of crystallization from them. Okay. So they can overcome by corresponding anhydrous salts or inert substances may be mixed before incorporating other ingredients. That means for them, if they are releasing the water or the water for crystallization, if you add any counter substance to that, that counter substance would absorb that particular water and make this efflorescent powder safe without being affected by the stability problems. Okay. Example here is a caffeine. In most of the houses, you must have seen, like whenever your coffee powder is exposed, your mother would have been told, come on, put the cap of the coffee powder firmly, or else it will become hard. Why it is becoming hard? Because that crystal, which is having the water for crystallization, it is releasing the moisture when it is exposed to the atmosphere. So when it is releasing the moisture cannot go anywhere from the, it doesn't know any magic to go out of the bottle, to go out of the container. So it will be present in the container and your coffee powder will become hard enough. Okay. So that is why you should not keep the caffeine bottle, like coffee bottle, very loose enough, or you should not expose that to the atmosphere. So this is one of the example for the efflorescent powders. And then eutectic mixtures, one of the most special type of the mixtures here. Like when two or more substances are mixed together, they liquefy due to the formation of a third compound which has lower melting point than the individual substances. Okay, like here you have taken two substances, substance A and substance B. Substance A is having 50 degrees centigrade as a melting point and substance B is having 60 degrees as a melting point. When they mix it both together, there is a formation of a third compound whose melting point is less than the melting point of these two, around at 30 degrees or 40 degrees centigrade. So what happens when these two substances are mixed together? They may undergo some stability problems as because of the formation of a third compound whose melting point is less than that of the individual melting points of these two compounds. Right? So that compound, the third compound, is called as a eutectic mixture. Such substances are called as a eutectic mixtures like thymol, camphor, phenol, salol, aspirin, etc. All these comes under these examples. So how you can dispense them? Because you know that when they both are mixed together, a third compound is forming whose melting point is less. So they can dispense as a separate set of powders with the directions that you have to emphasize on this. one set of each kind shall be taken as a dose. That means if you are having two packets should be mixed together, because one packet is containing one compound and the another packet is containing another compound. Both, if they are mixed only, they are going to show the action on your body. So both, they have to be mixed together before the administration, and then they have to take an equal amount of any inert substances like magnesium carbonate or like light magnesium oxide, kaolin, starch, lactose, etc. They can be mixed with eutectic mixtures and then blended using the spatula, so that uh, during the preparation there won't be any problem of formation of the eutectic compound, right? So this is all about the different types of the powders that we have. So we have seen about the introduction. We have seen about the classification of the powders, where we have seen about various types of the powders. Now, let us see about what is the method of preparation of these powders. Okay, there is a general method of preparation of the powders. You'll be having only 5 steps here. The first one is reduction of particle size by trituration, levitation, and pulverization. So trituration is nothing but you'll be taking your favorite mortar and pestle, and in that mortar and pestle, you will be adding the ingredients like API and all the other ingredients which were given. You'll be adding all the ingredients and you'll be triturating. Don't triturate as if you have some very bad feeling on the mortar and pestle. You have to triturate them very smoothly. You are just making it to have the uniform size distribution of all the powders. You just don't want to grind and make a paste of the powders, right? So here you just want to mix all the powders to have the uniform distribution. And then levitation and pulverization. Pulverization is nothing but there will be certain substances which are gum in nature, like your acacia, tragacan. Okay, they will be gum in nature, which cannot be mixed with the other ingredients properly. So what we do is here, first you'll mix that in some solvent. You will be mixing that ingredient in the solvent. Then that solvent would be mixed with other powders. During mixing, the solvent would evaporate and it will leave only the active ingredient in the composition. That is called as a pulverization, where you are reducing the particle size. Once the powders have been reduced to the required particle size, then you go for the sieving. Okay, sieving is here again to have the uniform distribution of the powders, or to have the uniform particle size of the powders. Okay, here I can just relate this particular preparation of powders to the preparation of a cake. Yes. So this is a cake season, you must be knowing. So once you take all the powdered ingredients, what you will be doing, you just sieve them. Though they are very fine in nature, you'll be sieving them. Why do we sieve them? Because as they are passing through the sieve, through a particular number of the sieve, we assure that they are having only that particular particle size. And then when all these are sieved, it will be having some spaces, extra spaces in them, so that one ingredient can be mixed with the other ingredient very easily. That is why you sieve them. And then weighing of the ingredients. Once you are sieving them, then you are weighing the ingredients, because we are not preparing only the bulk powders. Certain times we are preparing even the divided powders also. That means the individual doses. So in order to pack the individual doses, now you have to weigh the ingredients and you have to keep them separate. And here comes the king of the show, the mixing. So here the mixing again will happen in a various ways. The first one is the spatulation. That means you'll be just taking a tile, and on the tile you'll be mixing, you'll be having the powders, and you'll be just mixing with the help of the spatula. See, if you remember, the spatula consists of two ends. The first end will be in the form of a spoon, which will be using them to take out the contents from the container. However, the another edge, it will be in a flat blade. We call it as a blade of the spatula. That spatula, with the help of that blade of the spatula, you'll be mixing all these ingredients because it is flat. And even the same thing you can use even for the making of ointments also. Okay, so for mixing purpose, you'll be using. So the first one is the spatulation. Second method is again the trituration by using the mortar and pestle. The third one is the geometric dilution. Geometric dilution is nothing but here you'll be adding the ingredients in a geometric progression. Okay, you'll be adding the ingredients in a geometric progression, like the least content will be added first, then followed by the other ingredients depending upon their quantity. If any diluent is present along with the ingredient, you will be adding the small quantities of the diluent as well. That is called as a geometric mixing or geometric dilution. And then finally, we have the packaging. The packaging, it can be done either in the bulk form or in the divided form. If it is in the divided form, you have to pack them in the packets. In the paper packets, you have to pack them. Okay, so these are the general steps that we follow in the preparation of the powders. So this is all about the pharmaceutical powders. So if you just go through this webinar even after, like before going for an exam or so, then you can easily write your exam because everything has been given in detail here, right? Now, if anyone have any doubts.